Anyway, let's talk to Dr. Chris Smith, British consultant virologist, lecturer at Cambridge University, presenter of The Naked Scientist. Very good morning to you, sir.
Good morning, Mike.
So, we're told once ago, how do you know it's winter? You know it's winter because the NHS always warns you that they're going to have a winter crisis, and they're now saying they're going to have another winter crisis because not enough people have been vaccinated and loads of people have got flu. Well, isn't it the same story every year?
Yeah, I think what's made headlines this year is that we've got not just a triple whammy, but a quadruple whammy. We've got 4 big viruses. These come every year, but they've come all at once, all in big numbers, and we've seen a really big escalation in flu cases. And so it's got everyone excited. It does happen from time to time. When I first became a virologist a number of years ago, I remember flu arriving very early that year. And when you get an early start to the flu season, you can get big numbers.
Yeah.
And indeed, I think we're up about 400% on where we were this time last year. So we always expect a flu surge, but it's much bigger this year.
But it's funny, isn't it? Because during COVID, the COVID years, flu more or less disappeared.
Oh, it completely disappeared. Many of the respiratory infections went completely. And what we then got is a period of payback, because the measures that were put in place to control COVID, birds of a feather flock together, and the measures that control the spread of one respiratory infection will control inevitably others, and flu's among them. So we saw flu numbers completely collapse during the pandemic because we weren't transmitting infections very efficiently. Then it came back with a flourish, but it came back not with the same seasonality that it used to have, because there was a sort of reset going on, and now it's settling back into its seasonal pattern. And that's why we're seeing it coming back in the autumn. Normally it's a little bit later than this, but we are seeing quite big numbers this year because we've got lots of people who are susceptible to flu. It's changed a bit. The flu changes with each flu season, so the immune system's always playing catch up, and there is a lower uptake of vaccination. And all those factors have conspired together to create a more susceptible population, and that's leading to more cases.
Yes. They also say the problem with the NHS crisis is that there's an awful lot of people off sick in the NHS. So why are there so many people off sick in the NHS?
I don't know those numbers, and I haven't seen that particular report. But what we do know is that flu doesn't just affect patients, of course, it affects the workforce. And if you've got highly transmissible infections like flu, but also the other ones doing the rounds at the moment, RSV, the respiratory syncytial virus, causes a heavy cold, but it can be lethal for little babies and very bad for elderly people. That hits the staff as well. The other nasty one, norovirus, winter vomiting disease. This is causing lots of cases at the moment, and we have to put people off work to do good infection control. Otherwise, people will come to work and bring their infections with them. So it's a sort of knock-on effect. As soon as you get lots of patients with something, you then get staff being infected. We can do something about the flu because we can have flu vaccines, and flu vaccines work about 60 or 70% of the time because it's a best guess on what we think is going to circulate in that given season. But not all staff in all areas of the country have the flu vaccine, and not all patients do.
No.
So the more that do, the better, but not everyone does, so we will inevitably get cases.
The figures it says here in The Guardian, in the winter situation report, show an average of 751 adult hospital beds in England filled last week by patients with diarrhoea and vomiting or norovirus-like symptoms, compared with 406 at this point last year. The total number of beds filled by patients with norovirus symptoms, including children in paediatric wards, averaged 756. It's hundreds rather than thousands, though, isn't it? I mean, they're not sort of panicking. Why are they warning everybody about this?
Remember, those are the cases we do know about. And for every case,
but there's thousands of beds in hospital in this country, aren't there?
But for every case we know about, we then have to do good infection control. So if you imagine, most of our hospitals, they're quite old format wards, which means you have bays. They're not single rooms. So you've got a person sharing a bay with a number of other patients. If a person goes down with an infection, they've exposed all of the other people in that bay, which means you get 2 effects. One, you've got to watch the bay to see, are we going to get more cases? And in order to stop getting more cases and putting more people at risk, you may not put people into those bays, so therefore you may end up with empty beds there. And then also, if you do get onward cases, you have to close that bay and possibly that ward for a period of time to let the infection run its course and stop causing more new cases. So even though you've got very few cases you know about, the knock-on effects can be quite significant from an infection control point of view.
Yeah, no, I get that. But I just wonder whether it's a wise thing to do, because the reason I'm asking you these questions is because people have got a bit of sort of, you know, infection fatigue, I think, in this country. Having watched for, you know, day after day after day, Chris Whitty with his graphs and his, you know, his warnings about dreaded outcomes. And so when people see a Quad-Demic of emergencies in the NHS, and then when you look at the actual numbers, they're quite low, people will go, well, it's a bit exaggerated, and they won't take any notice of it.
Well, I don't think we can exaggerate norovirus. We think that costs us about 100 million a year. And it's not just the people who've got the infection, because it then causes problems for staff. It causes knock-on effects like cancelled operations.
Yeah, but you can't do anything about norovirus, can you? You can't get a vaccine against norovirus. Well,
actually, there's a trial which started just last month, which is actually going to hopefully vaccinate people against noro. They're starting with older people over 60s to stop the sorts of outbreaks that cause problems in care homes. If we can't send people back to care homes, for example, we block up beds in hospitals. So all these things have knock-on consequences. But we can do infection control. And that comes back to where I was just saying. Often, in doing a good infection control, it causes a hold-up because it takes beds out of commission, and we're having to stop people coming in or going out of certain parts of the hospital while the infection runs its course. And so you don't need very many cases before you've already got consequences for large numbers of beds and bed spaces.
Yeah, I got you. Dr. Chris Smith, thanks very much indeed. British consultant virologist, lecturer at Cambridge University and presenter of The Naked Scientist.